You might think you know all about paracetamol overdose, but do the facts align with common misconceptions? Let's begin by unraveling the tangled web of misconceptions surrounding paracetamol overdose. It's a topic that is often misunderstood, with assumptions and half-truths clouding the reality. One such misconception is that paracetamol, also known as acetaminophen, is harmless due to its over-the-counter availability. Let's pause for a moment and think about it. Just because a substance is readily available, does it make it harmless? Of course not. The reality is, paracetamol, like any other drug, can be harmful if not used correctly. It's a powerful painkiller, and when used responsibly, it can provide significant relief. However, an overdose can lead to severe health complications, even death. Another common misconception is the underestimation of paracetamol's toxicity. It's true, paracetamol is safe when taken as recommended, but when the recommended dose is exceeded, it can cause serious harm to the liver. The liver is responsible for metabolizing paracetamol, and an overdose puts an immense strain on this vital organ, potentially leading to acute liver failure. Some people also believe that a paracetamol overdose will immediately cause severe symptoms. In reality, the initial symptoms can be relatively mild and nonspecific, such as nausea or general discomfort. This can be dangerous, as it may delay medical intervention, allowing the toxicity to progress. There's also a false perception that paracetamol overdose only happens to those with addiction issues. The truth is, it can happen to anyone. A simple miscalculation or misunderstanding of dosages can lead to an accidental overdose. In the end, it's important to remember that paracetamol, while a commonly used medication, is not without its risks. It's essential to follow dosage instructions carefully and to seek medical attention immediately if an overdose is suspected. Now that we've debunked these misconceptions, it's time to delve into the science behind paracetamol overdose. So what exactly happens in your body when you ingest too much paracetamol? Let's delve into the science behind this. When you take paracetamol, your liver gets to work, metabolizing it so it can be safely excreted from your body. It's a complex process, but essentially, the liver uses enzymes to convert the paracetamol into substances that are easier to eliminate. Most of it is converted into harmless substances and excreted in your urine. But a small portion, about 5 to 10%, is metabolized into a harmful byproduct called NAPQI. Under normal circumstances, this isn't a problem. Your liver has a natural defense mechanism against NAPQI. It contains a substance called glutathione, which binds with NAPQI and transforms it into a harmless substance that can be excreted. But here's where the problem arises. If you ingest too much paracetamol, your liver produces more NAPQI than it can safely handle. This excess NAPQI can't be neutralized by the available glutathione, and this is when things start to go downhill. The surplus NAPQI begins to attack the liver cells, causing damage and, in severe cases, leading to liver failure. It's a bit like a city under siege. If the city's defenses are overwhelmed, the invaders can cause widespread destruction. It's important to understand that this isn't an immediate process. It takes time for the liver to run out of glutathione and for the damage to become apparent. This is why symptoms of paracetamol overdose don't appear immediately, and why it's so crucial to seek medical help as soon as possible if an overdose is suspected. It's also worth noting that the amount of paracetamol that can cause an overdose varies from person to person. Factors such as age, overall health, and whether the person is a regular drinker can all influence how much paracetamol the body can safely handle. The toxic effects of paracetamol overdose are indeed alarming, but how does it manifest in the body? Feeling unwell after taking too much paracetamol? Here's why. When you ingest more paracetamol than your body can safely metabolize, it can lead to a condition known as paracetamol overdose. The symptoms of this can vary, but most commonly include nausea, vomiting, and abdominal pain. Let's delve a bit deeper into why these symptoms occur. Paracetamol is primarily processed in the liver, where it's broken down into several metabolites. Some of these are harmless, but one in particular, known as NAPQI, can be harmful in large quantities. Normally, your body can safely eliminate NAPQI with the help of a substance called glutathione. But when you take too much paracetamol, it depletes your body's glutathione reserves, allowing NAPQI to build up. This buildup of NAPQI can cause significant damage to your liver cells. This is why one of the first symptoms of paracetamol overdose is usually abdominal pain, as your liver is located in your abdomen. If left untreated, this liver damage can progress to liver failure, a life-threatening condition. But the effects of a paracetamol overdose aren't limited to your liver. It can also cause damage to your kidneys and potentially lead to kidney failure. In addition, it can cause confusion, convulsions, and in severe cases, coma or even death. It's also worth noting that the effects of a paracetamol overdose aren't always immediate. In some cases, you might not notice any symptoms for the first 24 hours or so. This is why it's so important to seek medical attention if you suspect you've taken too much paracetamol, even if you feel fine. In conclusion, a paracetamol overdose can have severe effects on your body, particularly your liver. It can cause a range of symptoms, from nausea and abdominal pain to liver failure and death. It's clear that paracetamol overdose is something to be taken seriously, but what are the key points to remember? We'll discuss that in the next scene. To ensure you're well informed, let's recap the main points about paracetamol overdose. Paracetamol, also known as acetaminophen, is a common household medication, widely used to alleviate pain and reduce fever. However, a common misconception is that because it's so readily available, it's completely safe. This couldn't be further from the truth. Just like any other drug, when taken in excess, paracetamol can cause serious harm to the body. The science behind a paracetamol overdose is tied to the liver. When taken in the right dosage, the liver can safely process paracetamol. However, when we ingest too much, the liver struggles to cope, and a toxic byproduct called NAPQI is produced. This substance can cause severe damage to the liver cells and can even lead to acute liver failure. The effects of a paracetamol overdose aren't always immediate. You might not feel unwell right away, but over time, symptoms like nausea, vomiting, and abdominal pain can start to set in. These are signs that your liver is struggling to cope and needs immediate medical attention. In severe cases, a paracetamol overdose can lead to liver failure, and if left untreated, it can be life-threatening. It's also important to remember that the risk of a paracetamol overdose isn't just from a single large dose. Regularly taking slightly more than the recommended dose over a long period can also lead to what's known as a staggered overdose. This can be just as dangerous, if not more so, as the damage to the liver can accumulate over time, often without any obvious symptoms until it's too late. But let's not forget, paracetamol is a valuable medication when used responsibly. It's a powerful tool in our healthcare arsenal, providing relief to millions of people worldwide every day. The key is to always follow the recommended dosage and to seek medical advice if you're unsure. Remember, while paracetamol may be readily available, it's not without its dangers when misused. So, how can you prevent paracetamol overdose? The answer is simple yet profound, and it starts with understanding. Understanding the medication you are taking and the possible repercussions of not following the recommended dosage. Paracetamol is a common household drug, and it's easy to overlook its potential for harm. But remember, even the most benign substances can become dangerous when misused. One of the most effective ways to prevent paracetamol overdose is by adhering strictly to dosage instructions. These instructions are not mere suggestions. They are the result of rigorous scientific studies designed to maximize the drug's effectiveness while minimizing its risks. So, whether it's a prescription from your doctor or an over-the-counter medicine, always follow the recommended dosage. If you find yourself in doubt, don't hesitate to seek medical advice. It's better to ask questions than to risk an overdose. Healthcare professionals are equipped with the knowledge to guide you through the safe use of medications. They can provide personalized advice based on your health history and current medical condition. Aside from personal vigilance, we can also play a part in preventing paracetamol overdose in our communities. Spreading awareness about the dangers of paracetamol overdose can go a long way. It can save a life. Remember, knowledge is not just power, it's a responsibility. We must share what we know to protect those who don't. And while we're at it, let's dispel the myth that paracetamol overdose is an issue only for those with a history of substance misuse. It can happen to anyone. It can happen when a high fever leads to desperation, when pain becomes unbearable, or when misunderstanding leads to miscalculation of doses. In conclusion, preventing paracetamol overdose requires a combination of personal responsibility, professional guidance, and community awareness. It's about understanding that every medication, no matter how common, has the potential for harm when misused. Stay informed, stay safe, and help others do the same by sharing this knowledge.